Welcome to Rogers TV's COVID-19 local update for April 3rd, 2020. Over the next half hour, we will bring you the updates on the pandemic in the area. I'm Anandi Carroll-Woolery. Brantford Mayor Kevin Davis spoke on camera about the additional closures and what to do during this time.
On Monday, I made an order based on a recommendation given to me prohibiting the use of all playground amenities for the city of Brantford, designed to reduce the community spread of COVID-19 coronavirus through our community. And that was followed hours later by a more comprehensive announcement coming out of the province. So I can tell you today what the combined impact of those two orders is. And what it results in is a closure of all communal or shared, public or private, outdoor, recreational amenities everywhere in Ontario. And so what does that include? It includes playgrounds, sport fields, basketball and tennis courts, off-leash dog parks, bike parks, BMX parks, outdoor exercise equipment, condo parks and gardens, and other outdoor recreational amenities. So green spaces in the parks, trails, and ravines, and conservation areas that aren't otherwise closed remain open for passive use, essentially walking. Now, we recognize here at the City of Brantford how important our great series of parks are to our residents, and the decision was not made lightly. However, clearly at this time, the top priority is protecting the health and safety of our residents, and open public space areas had become a potential point, in some cases, actually had public gatherings occurring. And so, I just understand again that we're asking a lot of you because it's very disruptive, but it's designed to protect all of us. So on last Friday evening, the province told cities that you now have the power, your bylaw enforcement officers, to enforce these rules. And that was, we didn't have the power before that, just the power to enforce city bylaws. To staff's great credit, they went out of their way over the weekend working overtime to get this in place, and believe me, it's been a real challenge. And so what we have in place now is our 6 bylaw enforcement officers. It's a very limited force. There's only so much we can do with that department. And previously they were caught up in doing all the bylaw infractions, and now they're going to have to focus on this. So how do you report a possible infraction? Preferably by email to covidviolations@brantford.ca. So COVID violations, or you can call the city's customer care center at 519-759-4150. We prefer you email. The Brant County Health Unit also has an investigative team, and they're focusing on businesses and making sure businesses have appropriate safe practices in place, particularly hygiene. And so if you see a problem with a business that's essential, that's still operating, then you call the inspections department, the Brant County Health Unit, and that's 519-753-4937, extension 470. So we have limited resources here, so we had to decide to prioritize, and we have 3 priorities for the city bylaw enforcement officers in this order of priority. One is the use of city-owned amenities, that's the playground structures and so on, gatherings of 5 or more in a public space, and non-essential businesses that are still operating, particularly those that involve close contact with their customers. What we can't investigate at this time is reports people who've traveled abroad and are not quarantining. That's a federal law. We don't have jurisdiction to deal with that. Non-compliance with mandatory quarantine orders, that goes to the health unit. Construction sites or related works, that's the Ontario Ministry of Labour. And non-compliance with that social distancing of being 6 feet apart from anyone else in a public space. And that's because there really is no law that prohibits that, at least not in a public space. Obviously, it's something we're all expected to do, but so far the province has not made that an order or rule of law. So, but that could well change if we don't pay attention to it and observe it. And so, I guess the question is, so what is permitted? And so I can tell you that, also consequences. So you can be fined up to $1,000. So please pay attention, do the things we've been asked to do to protect ourselves, our loved ones, our families, and all of us. By doing all of this, we protect ourselves. So in particular now, what is permitted? So what is permitted is you can use city-owned trails and public spaces for walkthroughs. You can take your dogs for walks, keep your dogs leashed, but obviously maintaining that social distance of 6 feet, 2 meters. And you can walk through city-owned park open spaces beyond the trail system, again, maintaining the physical distancing. But remember, the best thing to do is to stay home unless you're providing an essential service or an employee of an essential business. Only leaving your home for essential trips, such as to the grocery store or the pharmacy. But hey, our local businesses are doing a great job providing innovative ways to deliver the necessaries of life to us through delivery services. Please use them. And this had a big impact on our local businesses, and I'll be talking about that in a later video later this week. So I want to thank all of you. Here at the city, we're very grateful for the 99.9% of us that are observing the rules and doing all the things that are required to do to safeguard us. So thank you for that. So stay safe, stay calm, and stay strong. Thanks.
Brant County Health Unit has announced that on April 2nd, a woman in her 60s with pre-existing health conditions has passed away due to COVID-19. Brantford Mayor Kevin Davis released a video in response to the situation.
This evening we learned some very disturbing news, and that is we've had the first person pass away from COVID-19 in our community, a lady in her 60s. And, when I heard that news, it was, it makes it really come home, the seriousness of the situation. We've been hoping that this wouldn't happen, but I think we kind of knew in the back of our minds that we'd be facing this. And I want to express my deepest condolences and sympathies to the family, friends, and loved ones of the lady who's passed away. And then for the rest of us, what it tells us is that we have COVID-19 in our community. We must be taking it very seriously. Most of us are, and using the tools we have available to us to deal with this virus, which are the social distancing, staying at home unless you're an essential worker, you must take an essential trip outside of your home, washing your hands, not touching your face. So let's work together. Let's do the things we're supposed to do. It'll flatten the curve. It'll reduce the impact in our community. And I want you to stay safe, stay calm, and let's carry on. God bless. So I'm outside City Hall tonight on what's a very sunny, blustery evening. Very important announcement last night by the province. They've decided to give us a grant of $970,000. That combined with $300,000 we've received from the federal government will allow us to do the things we're currently doing, for example, in our homeless shelter system to adjust to the COVID-19. It'll allow us to take other initiatives to deal with the social impact of the COVID-19 virus on our community. More announcements will be coming out from the city as to how that money will be spent over the next several days and next week. So, a couple of housekeeping items. I've been asked by staff to tell you that please do not put sanitary wipes in your toilets. They clog up our sewer system and in particular our sewage pumping stations, of which we have 9 through the city. Also, there's some confusion yesterday whether the rules regarding public gatherings apply to cemeteries. Those rules do. You cannot use cemeteries for public gatherings. Obviously, cemeteries can be used for funerals, but not to exceed 10 people at any one time. If anyone wants to use cemeteries to try and get around the rules, it's not going to work. Kind of a feel-good initiative. Tomorrow we're going to be doing a lot of video showcasing certain departments of the city, and in particular some of the staff and some of the great things that they're doing and to deal with the COVID-19 virus and to help our community. And also a drive-by of the hospital around 12:30 by police and fire, sounding sirens and horns to show all the hospital and all the staff that work there all the support they have in our community for all the things that they're doing for us and protecting and caring for us. So have a good evening, and until tomorrow, there should be a couple of rather interesting videos. Good night.
Our very own C-Suite host, Danielle Deshaw, spoke with mediator and conflict coach Sarah Turrell about conflict and how to resolve it in our workplace.
Welcome to this special segment where we are talking about and having conversations about the impact COVID-19 is having on our work, what we do, and how we do it. And we're also going to be providing you with some help and support and solutions to help you to continue to lead confidently for your organization, your teams, and yourself. Today, joining us is Sarah Turrell. She is a mediator and conflict coach from Empower Results in Halton Hills, and she's going to be talking to us about really the impact COVID-19 has had on conflict and resolving conflict in our workplace today. Thank you, Sarah, for being here today.
Thank you for having me.
So, different environment from even, say, a month ago. How has COVID-19 shifted either the root cause of conflict or the face of conflict in organizations?
Well, I think it's affected it in two big ways. The first is that everyone's unsure, they're stressed out, and they're working with new challenges. So we're a little bit of a powder keg, right? Everybody's sort of on edge, which leads to it being easier to actually jump into conflict. So I think a lot of people are seeing a lot more, or they're stressing out about conflict. So that's the first. And the second is because we're not actually able to walk over and talk to people anymore, we've lost that face-to-face interaction. A lot of people are using email and text a lot more than they used to. And those are some of the worst ways to communicate difficult conversations because you get misunderstood. So that's creating a lot of conflict as well because now people are communicating completely differently and it's just not working.
Mm-hmm. Yeah, the emoji says something very different than an actual conversation.
I see a lot of people who can't decide if an emoji is sarcastic or if it's a legitimate smile, and the amount of time they spend weighing either an exclamation mark or a smiley emoji blows my mind.
Mm-hmm. So if we're not sitting beside each other, we're not even in the same building anymore, how can we go about resolving conflict?
Well, the first thing that's really important to do is to remember that if you're stressed out, they're probably really stressed out as well. So actually taking a time, I like to talk about marshmallows. We all have a soft, squishy inside. So actually remembering that that other person has a soft, squishy inside as well. And even just thinking of that changes the tone when you speak to them. But the big thing is sort of what we're doing right now is we have the technology to video chat. Empathy really requires eye contact. We have the ability to even make phone calls. So then they can hear your tone. You can pivot the conversation. If you feel like someone's misunderstanding what you're saying, in that moment you can change it. When you send an email, you lose complete control over the tone it's read in and the environment in which it's read in. You don't know what kind of mood they're in. So really one of the best things people can do for conflict resolution and management right now is actually pick up the phone. Even though it seems harder, in the long run, everything works out better when you either video chat or take phone calls.
Mm-hmm. I like that. And so are you seeing almost like the little things are now becoming turning into the conflict, whereas before people could just kind of work through things pretty easily, but it's those small things now that are creating potentially big issues.
Yeah, and people are stewing on things, right? They don't have the opportunity to address it right in the moment. So someone might send you an email and you're not even looking at it for a couple of hours, and in the meantime, and then you can't answer right away or whatever the case is. So people, because they're already stressed, right? There's so much going on outside of work that is stressful, and now they're bringing that into their communication at work. And tiny things, which usually are symptoms of bigger things, but tiny things are really setting people off. Mm-hmm. And I think we all just need to remember to give each other some grace and a little bit of space and time so that we can understand that we're all struggling a little bit, and that can really help when we're trying to disagree. Because we can disagree. It's all about disagreeing productively and kindly.
Mm-hmm. So what are some signs that leaders can be looking for? Are they little signs or behaviors that there could be some conflict brewing, and really try to mitigate that and have the conversation before it really creeps into something bigger?
I think you can see it a lot when you see people replying all to more people than need to be on a conversation. What will happen is often a reply list will explode. So it'll start between maybe 3 people, and then next thing you know, 6 people are on it. Because people, when they're angry, are trying to draw other people in to back them up. So I think leaders can look to that. I think leaders just have to be aware of their employees and reaching out and actually having conversations with their employees to check in and make sure that everything's okay. And I know that's hard to do when you have a large team. So the easy thing for them to do is send an email, but they should know well who their employees are that might need a phone call and an actual check-in to find out how they're doing so they can have those conversations, because it's really important to actually speak.
Yeah, because then you get tone and reference and
Yeah.
being able to see someone's emotions too.
Yeah.
Okay. Well, thank you so much, Sarah, for being with us today and sharing some different solutions and tips on how leaders can help, really lead their teams and have the conversations that they need to have to resolve any conflict that they're having right now.
Thank you for having me. There's tons of great technology out there to let us see each other, so take advantage of it and make that hard decision to have that conversation.
Absolutely. Thank you so much.
Thank you so much.
Lens Mill stores are putting together kits for people to sew hospital gowns and masks to donate to hospitals and their frontline workers. Elaine Oakes from the Brantford store joins Rogers TV producer Patty Berardi by Zoom to give her the details.
Elaine Oakes is joining me from the Lens Mill store here in Brantford, where she is the manager. Elaine, can you talk a little bit about what Lens Mills is doing during this COVID-19 pandemic?
When all this started, for starters, Lens Mill store has closed because we want to be able to keep our social distancing, keep our staff and our customers all safe. Once we did that, everybody all of a sudden started wanting to make fabrics, to make gowns and masks and everything they can to help the hospitals and everybody that needs the support. And what we found was we started, because we were inundated with phone calls, we started taking some of the pressure off. And what we did is we're now making hospital gown kits and mask kits and the caps. And then the customers can purchase the packs. So we're selling these really funky, this is one of the hospital gowns there. And these are the packages. So we're selling these in single and 5 packs for customers to purchase. And then they can make them up and then donate them off to whatever organization, whether it's the hospital, or whether it's nursing homes. We had a lady stop me the other day and ask me if she could get fabric to do gowns for sorry, my brain, for midwives. Somebody just yelled it. Brain is just gone with self-isolation. So the request is there. Our London store is also making them, and they actually have provided over 500 gowns to a hospital in London. And if you go to our website, www.lensmill.com, they actually have a picture of the workers in their gowns in front of the hospital. They look fun. Like this is going to be fun because we're not just doing plain colors. We're doing some really funky prints.
And what has the reaction been to this locally?
Locally, well, what we've been doing up to this point is we've been making the gowns and then we send them to our Hawkesville location because they have a postal outlet. They've been able to mail them out. But what Lens Mill store has started doing is we've opened up 6 locations, the Brantford location, the London location, Port Dover, Hawkesville, and of course, all my notes are too far away. And what they're going to do is we're going to do, you can order them through the website, pay for them, get them ready. They'll get a hold of us. When we have your order ready, you can come by the store and we're going to do curbside delivery where we'll give you a time to come. You get here, we're going to meet you, put them in your trunk so there'll be no contact with everybody. We're still going to maintain our self-isolation, our personal space. And then they can take them home and sew them up and donate them off. And so we're hoping that takes off really well.
And what has the reaction been to your staff? How does it feel to be able to contribute like this?
The staff has loved it. They like being able to say that they've done their part. Also, it gets them out of the house. There's 6 of us here, so we're all amongst ourselves. We're keeping our personal distance, but that way we're not getting on our loved ones' nerves either.
And so just again, tell people how they can get a hold of these kits.
So if you go to our website at www.lensmill.com, you can order the kits, the mask kits, or the gown kits. And then depending on what store they're at and where you are, they can either be mailed to you or we can have a curbside delivery picked up at one of our locations that are offering it.
Excellent. Well, thank you for your time. And this is a wonderful initiative by the Lens Mill Store. It's much appreciated within our community and communities in Ontario.
Lens Mill Store is here to be part of everybody's community. We want to help as well as be there.
The region of Waterloo has made all service on Grand River Transit free until May 31st. This includes buses, Mobility Plus, and the Ion. Here is the region's press conference as of Friday, April 3rd, about the situation in the region.
We have Highview Residences, which is an outbreak where we have 3 residents who have tested positive. We have one at Sunnyside Home where 2 staff members have tested positive. We have one at Forest Heights, Rivera, where 1 resident has tested positive. One at St. Luke's Place, where 1 staff member has tested positive. One at the Village at University Gates, where 1 staff member has tested positive. One at Chartwell Westmount, where 1 staff person has tested positive. So those are our latest numbers, and apologies, they're either updated right now or they will be in 5 to 10 minutes. So we have seen a significant and rapid increase in cases at long-term care homes and retirement homes in other parts of the province. And as you can see now, we're also tracking long-term care homes under outbreak in our region, and we've started to have those as well. Given what we've seen elsewhere in the province, we should expect to see the numbers of homes under outbreak and the number of cases rise here locally as well. So our homes in Waterloo region are working hard and taking steps to prevent or slow the spread of COVID as much as they can. That said, we need to remain vigilant and monitor the situation closely. Now I'd like to talk about the overall status of cases in Waterloo region. So far, the speed of increase of cases in Waterloo region has been manageable for our healthcare system. That is the primary goal, and that will continue to be our goal. That is to do all that we can as a community so that our health system can cope. As we are seeing that cases continue to rise across Ontario, we should expect that we will continue also to have new cases in Waterloo region for some time. So we should expect to see more cases, more hospitalizations, more patients who will need care in ICU, and sadly more deaths. I'd just like to say that we are still in the early phases of this pandemic. That doesn't mean that the efforts we've made as a community to date haven't had an impact. I believe it has, and it has prevented many cases, hospitalizations, and deaths that we would have otherwise seen. But I don't believe that new cases will subside anytime soon. I believe we still have a long road to travel in the fight against COVID-19. We don't know exactly how long that road will be, but we do know that every time each of us does what we can, we will continue to positively impact the outcome.
Thanks, Bethany. The update I wanted to provide today is related to some changes to transit service. And I think our media partners would have got a media release earlier this morning announcing some pretty significant transit changes. So effective immediately, GRT service will be free until May 31st, 2020. We're also in the process of making changes to transit service frequency as a result of some challenges to provide adequate staffing and significant reductions in ridership. So we will be making changes to the frequency of service on a number of routes and those service changes will go into effect starting April the 20th. There'll be lots more communication over the next week with our customers about what those specific changes are. It amounts to about a 25% reduction in transit service. We're trying to keep the same overall duration of service during the day, so the same start and end time in the day, but basically just reducing frequency during the day on some routes, recognizing that ridership is down significantly. We have 2 customer service locations that have been open to the public. With the changes we're making now, those 2 customer service locations will also close to the public effective April the 10th. Related to the free service, customers who have purchased an April monthly pass, that monthly pass will automatically roll over to the next month when fare collection resumes. So currently, that's anticipated to be June. So all of the monthly pass holders who are comfortable with their pass rolling over to June, they don't need to do anything. Other pass holders who may have other circumstances, they can call the region's customer service line if they want to explore other options around refunds.
These are the current outbreaks due to COVID-19 as of April 3rd, 2020. For Waterloo Region, Highview Residence, Sunnyside Home, Forest Heights Rivera, St. Luke's Place, The Village at University Gates, Chartwell Westmount. For Wellington Dufferin Guelph Public Health, Guelph General Hospital, Homewood Health Centre, Norfolk Manor, St. Joseph's Health Centre. Please contact Huron-Perth Public Health or Brant County Public Health for updates in these regions. Rogers TV will have COVID-19 updates as they come out. Stay tuned to Channel 20 to stay informed about the situation in the area. Be sure to check out the RTV quiz on Rogers TV for exciting trivia fun. Wednesdays at 7:30 p.m. on Rogers TV and rogerstv.com. Please make sure to practice social distancing, stay home unless you must leave, and wash your hands frequently. Thanks for watching, and we'll see you soon.